Hi, my name is Miriam Katz. I'm a third-year medical student at New York Medical College. So hypertension or high blood pressure affects half of US adults and is the leading risk factor for cardiovascular disease, which is the #1 cause of death in the United States. Individuals from certain racial or ethnic groups, as well as individuals of lower socioeconomic status, are at higher risk for hypertension, but are less likely to have their hypertension under control. Overall, patients from these specific groups have worse health outcomes from cardiovascular disease compared to patients from privileged backgrounds with the same exact diagnosis. The focus of this research is really to understand whether digital health interventions like remote blood pressure monitoring are impactful and helpful for patients from these underserved groups. Remote blood pressure monitoring is a tool that can be used to keep tabs on a patient's blood pressure even when they can't make it to the office. And the patient will take their own blood pressure and the data will be electronically transmitted to their healthcare provider. Remote blood pressure monitoring kind of extends healthcare outside of the clinic and into the patient's home so they can keep better track and keep on top of their hypertension or whatever chronic disease without always having to go into the office. If we can create new technology with the goal of alleviating disparities in health outcomes between patients from underprivileged backgrounds and patients with privileged backgrounds, then we can do a lot of social good with the new technology that we're developing. So by extending healthcare outside of the clinic, we've seen that more patients who would typically fall through the cracks of the healthcare system are able to manage their chronic disease and keep tabs on their hypertension, which leads to a decreased risk of overall cardiac disease, decreased risk of more acute or severe cardiac disease, and an overall longer and happier, healthier lifestyle.